Good morning, ladies and gentlemen. I have a honor to speak to you today on behalf of the European Commission about its actions in the field of cancer. And I wanted to start my presentation from the few figures about cancer epidemiology, but after this very informative and very interesting lecture of Professor Crespi, I will skip one slide and I will go directly to the details about the legal basis of health activities in Europe, and further I will tell you some examples of those actions and possibilities for the future. No, it should be okay, but it is not.
The right arrow forward.
The right is forward. Okay, thank you very much. Okay. No, it's not working. I don't know why.
It's pushing.
It's this one. Okay. Okay, thank you very much. Sorry. The Treaty on European Union made a public health on an official EU competence for the first time, subject to subsidiarity, that is, the coordination of national policies at the EU level. However, the responsibility for the organization and delivery of healthcare remained on the national and regional responsibility. The Amsterdam Treaty did not introduce a EU health policy, but made a step in that direction in the Article 152, subject to qualified majority of voting in the Council. This treaty introduced a new legal competence to the legislate in public health on blood safety and organ issues, and it was the basis for the single EU public health program, about which I will say a few words later. The other articles of the treaty related to the health are Article 95 and Article 300, and altogether their aims are the following: to assure a high level of human health protection in the development of all community policies, to take actions to improve public health in the European Union, to prevent human illnesses and diseases, and to obviate sources of danger to human health, and also to provide independent and transparent risk assessment through scientific committees, and to implement public health program. The principle, according to this principle of subsidiarity, the community must not undertake or regulate what can be managed or regulated more efficiently at national or regional level. Now I will say a few words on EU actions, and the objectives of these actions, especially in the field of cancer, are rather simple. The first and foremost is to create a reliable and comparable cancer statistical resources to make the dimension of the problem known and allowing monitoring and decrease the mortality rates. And secondly, to promote healthy lifestyles for the population and to prevent the cancer and motivate citizens to participate in the screening programs. And thirdly, to develop and disseminate evidence-based scientific consensus, for example, on screening, on training in oncology. And the tool to obtain those objectives mentioned above is the EU Public Health Programme. Let me explain now in a few words what is this program about. And the program The current program runs from 2002 to 2008, and it has traditionally provided the mechanism for developing networks in areas of public health relevance, such as for blood organ safety, communicable diseases, and tobacco prevention, for example. And there are three main objectives and strands in the program on health information, health threats, and health determinants. And in all of those three strands, the activities related to cancer are developed. The Commission has embarked on partnership approach to develop, together with experts from the member states, the best practice in cancer screening, and published and known as a series of EU guidelines for quality assurance of breast cancer screening and diagnosis. And this was the first step to establish those guidelines for another cancers also. This was complemented in the 2003 by the Council recommendation on cancer screening, which was adopted by the Council on the basis of experience from the Member States and the basis on the recommendation of Advisory Committee on Cancer Prevention. And the Council recommendation on cancer screening describes in comprehensive set of recommendations how population-wide screening programs should be organized in member states, and recommends the three screening methods which in 2003 were sufficiently justified by available evidence. And the screening tests which fulfill the requirements of recommendation are the pap smear for screening for cervical cancer, and mammography screening for breast cancer, and fecal cord blood test screening for colorectal cancer. A detailed report from the Commission to the Parliament and to the Council on the implementation of Council recommendation on cancer screening is due by December 2007. Following the example of the best practice in breast cancer screening, EU guidelines on quality assurance in cervical cancer screening and diagnosis will follow soon, probably next month. And for colorectal cancer, a contract has been signed to develop for the first time such as EU guidelines on quality assurance in colorectal cancer screening and diagnosis. It is important to keep in mind that these evidence-based EU guidelines resemble a scientific consensus, and which is in a public domain. That means that it is owned by every citizen in the EU. The methods applied in a project for development of colorectal cancer guidelines will include establishment of multidisciplinary editorial board structure with writing review and review groups appointed by the co-chairman of editorial board, and also consultation of expert and with patients groups, literature searches, and data analysis, and also pan-European network building with well-planned multidisciplinary conferences and meetings on national and local levels also. Therefore, the Commission, the Member States, the European Cancer Network, national and international certification and accreditation bodies and NGOs, all they can freely refer to the European benchmark for the best practice in breast, cervical, and then colorectal cancer screening and diagnosis. I will come back. And now I will go to the priorities for the 2007 and for the EU priorities for 2007 and 2008 year. The priorities for 2007 are focusing certain key actions which have already been initiated before. And in cancer, the most important one is the preparation of the report, which I mentioned before, this implementation report on cancer screening recommendation. And the discussion in the Council and European Parliament upon the Commission communication on the implementation of Council recommendation will probably fall mainly under the Slovenian presidency on the first half of 2008. And the report will provide information on the implementation and possible impact on the recommendation, and in addition, whether possible, the degree of national implementation will be reported in relation to existing European screening benchmarks. The facts are expected to derive from two main sources. One is the scientific report from the European Cancer Network, and the second one is the questionnaire which will be sent to the member states. And on the end, I would like to draw your attention to new possibilities which emerged this year and which certainly can be used for active implementation of European screening policy on the national and regional level. For European regions lagging economically behind the necessary screening infrastructure like cancer registries, screening centers, and national measures could include support for investment under the health objectives from the European Fund for Regional Development, as well as for training from European Social Fund, wherever it is treated a priority by national authorities. The growing activity in the field cancer leads to a better understanding of gravity of disease and the importance of common cooperation. It is clear that EU has a unique role to play as a common platform for such activity in spite of its restricted legal provisions. Thank you very much for your attention.